Joint replacements are one of the most common orthopedic surgeries, with nearly 1 million knee and hip replacements happening all across the country annually. Here to talk more about it is Dr. Stephen Ridgway from Bon Secours Piedmont Orthopedics. And to make sure that when you come see him, you're coming to see him for the right thing and the right reason.
Exactly. That's a common source of frustration for patients when they come in and they've been waiting for weeks to be seen, and they deal with the frustration of the calls and all that has to happen to get a doctor's appointment scheduled. And then they come in and we say, hey, this isn't really the right kind of problem for us to take care of, or we need to direct you somewhere else. And we try to take care of those folks as well, but it'd be better and more efficient, and they have a more satisfying experience if they're properly directed.
You got to know exactly where it's coming from, right?
Exactly.
And joint pain seems to be like a really broad topic. What is joint pain?
Yeah, so what we're talking about when we talk about what I do is replacing hips and knees. So the joint, or in the hip case, it's the ball and socket that actually rubs and allows you to position your leg in space. It's in the front, in the groin, and down the thigh is where your hip would typically hurt, not where people call it their hip.
Which is crazy, because right here you would think
that tends to be the hip. Wow. The knee's a little bit easier because, you know, the knee's a little bit more straightforward. Everybody generally knows when their knee's giving them trouble.
Yeah.
But the big confusing thing is the lower back is often confused for hip pain, because when your back hurts, you hurt back here. People call that their hip. And I tell people, if you can see it in the front, that's typically the hip. If you have to turn around to look at it, that's typically your back. And so that's, and you're showing lots of images here, people who actually are rubbing their back. They think it's their hip, but that's their back.
So it's a good educational tool to show you that just because it's hurting in that area doesn't mean it is that thing that you would associate.
People get frustrated. They call our appointments and they say, look, I'm having terrible hip pain. I insist on seeing a hip surgeon. And our appointments try to direct them and say, look, we've got some back. You sound like this is your back. We have a whole back team. We can have you see those folks for all kinds of treatment, and they'll want to be seen for their hip. And then we see them, and then sometimes it is their hip.
Right.
But a lot of times we have just a very few questions that you can ask that really direct people in a more
I like that you're narrowing it
way.
down.
Yeah, trying to narrow it down. Yeah.
Who's kind of at risk for developing these
So it can really, both knees and hip arthritis is basically what we're typically dealing with. And the vast majority, it's a wear and tear phenomenon. So it tends to be middle age, so that typical age for joint replacements in the mid 60s. But you see people in their 40s all the way up until, we will treat people if they're healthy, even into their mid to late 80s, 90s, even into 100s.
If they're healthy. Lifestyle,
if they're healthy and they've got a problem that we can address, we will. And sometimes that's a big misunderstanding. People say I'm too young or I'm too old. And in the past that has been the case, but now with the techniques that we have and the quality of care of anesthesia and all the things that we can do and the rapid recovery programs, there's a lot more people who are suitable candidates for this surgery than in the past.
Yeah, and you kind of led us to it with what happens, how do you assess what the next step is?
So it's a wear and tear thing, and so one of the big risks is obesity. People get tired of us talking about weight, but it is probably the biggest single factor that anybody has any control over is managing your weight. Another big misunderstanding is people think, oh, I'm a runner, so I'm going to be more prone to this. Runners don't seem to be more prone for this problem, for having arthritic joints. It's people who don't do things you tend to see more often. So it's moderate activity is good. If you have an arthritic joint, high impact activity probably is going to aggravate it, so we don't recommend running if you already know you have an arthritic joint, but we don't suggest that anybody stop running if they have a well-functioning joint. So so that sort of thing. So the wear and tear, be active, be moderately active, keep your weight under control. That helps. That's the one thing that people can do to mitigate the risk of having to come see me.
Now, once they do come see you, is surgery the only option?
By no means. So there's sometimes I tell people, the categories are fairly broad. It gets, there's modifying what you do. So sometimes it's a conversation about how you do what you do. Some of it is medication. So when we're dealing with arthritis, we're dealing with inflammation related to damage. So you can't fix the damage with a pill, but you can affect the inflammation that's going on. So anti-inflammatory medications, injections, things like cortisone injections for flare-ups can sometimes help and sort people through a bad spell. There's other injections, there's various gels that we put in the joint to kind of lubricate the knee, but nothing changes the natural history of it. That wear and tear process goes on. We cannot change that. So sometimes people come in and say, I'd like to see you before this gets too bad. I can't change. I can talk to you about it, but I can't change this natural progression of wear. And so once it gets to the point where the non-surgical options aren't working, braces, modifying activities, injections, things like that aren't working, then surgery is going to be a part of the conversation.
Awesome.
Yeah.
On our way out, we have about 15 seconds. Tell us about this joint quiz that people can take.
Yeah, so this is something, I think I was on here several years ago.
Yeah.
And this came up, and so some smart person has developed basically a questionnaire, few questions to help direct people, like we were talking about at the beginning of the segment, about who should you see, when you should see them, are you an appropriate candidate, should you see an orthopedic surgeon. So this link that I think you're showing is to just sort of pop through a few simple questions to help direct people properly so they don't either waste their time seeing the wrong doctor and understand whether or not they should see a doctor. So that's the whole point of it.
This is why we love Bon Secours. They're getting you in and they're getting you to the right people. Thank you so much, Dr.
It's my pleasure.
We appreciate
Absolutely my
it.
pleasure.